Dominik has a sort of a technical background in AI and HCI, and David has a background in psychology, and they're also collaborating on some really interesting projects and approaches around using artificial intelligence methods as they're evolving in personalization and digital health. So thank you for agreeing to speak and present your work here today. And for now, the stage is yours.
Yes, thank you very much, Jan, for that kind introduction. Yeah, and thanks, Dominik, for sharing the slides. Yeah, very happy to give a bit of a presentation on novel AI systems and how we can use them for personalization in digital health. And specifically, we're going to talk about just-in-time adaptive interventions. If you haven't heard that term yet, then no worries. I'm going to give you a brief introduction into what just-in-time adaptive interventions, or in short, JITAIs, actually are. And then I'm going to present a new sort of generation of JITAIs that we have recently explored in one of our studies, before I then hand over to Dominik, who's going to tell you about how he's using context-aware AI to personalize JITAIs within his PhD work. So let's start off with what is a just-in-time adaptive intervention. The idea is that you send an intervention, you send the right intervention content at exactly that moment in time that it can have the most effect on the user. It is most well known from the digital health context, so that mostly we want to support people with their health goals. So, for example, physical activity, what we're often working on. And how this is conceptually supposed to work is that you have multiple decision points that are distributed over a day, and at each of those decision points, you would evaluate a decision rule, where you have some tailoring variables going into that decision rule, for example, how stressed someone feels at that very moment, or the geolocation of a person, or how active someone has been in the last couple of minutes. And then based on those the values of those tailoring variables and the decision rule, you're going to choose one out of a couple of intervention options, or just choose if you want to send an intervention at all. So, for example, a very simple just-in-time adaptive intervention that many of you might know if you're using wearables or physical activity trackers, they sometimes send you a little message to get up and walk around a bit if you have been sitting for too long. Now, we're looking at a bit more complex versions of such JITAIs that could do a little bit more than that. Because like what I just presented to you was could be framed as the first generation of JITAIs, where you have theory-informed tailoring variables and a theory-informed decision rule that decide which out of many intervention options that you have predefined or were predefined by healthcare professionals or researchers should be sent to the user. That has some problems because you can only be adaptive to some degree, because you have to you can at the most choose the best fitting option out of the list of intervention options. And it also brings some problems with the tailoring variables, because they always have to be in a very specific format for the decision rule to work. Then we already had a second generation of just-in-time adaptive interventions that are also referred to as personalizing JITAIs, where you still have theory-informed tailoring variables with the same limitations. But then you have a data-driven decision rule that can, for example, be powered by reinforcement learning algorithms. So the model would adapt to the user, and then, for example, only intervention options that actually work for one person would be sent to that person. But you, again, also still have the predefined list, static list of intervention options to choose from. So what we're now proposing, or have proposed in the recent work, is the third generation of just-in-time adaptive interventions, which we call dynamically generated JITAIs, where we use a large language model in the place of the decision rule and for the intervention options. So basically what we do is ask the large language model in the study that I'm going to present you on the next slide. We use ChatGPT with the GPT-4 model, and we asked it, in this very moment, for this person, would you send a just-in-time adaptive intervention to support them with their health goal, yes or no? And if you would send one, then please also phrase the message for us. So with this, you have the large language model as a decision algorithm, and also you have for each moment or each intervention always dynamically generated new intervention, which gives you a lot more adaptability than just having a static list to choose from. Now, that is what we looked at in a recent study, in which we first came up with 3 personas of cardiac rehab patients and 5 contexts that could typically appear in the lives of those personas, and then took those 15 persona context pairs and inputted it into ChatGPT and asked it, would you send a just-in-time adaptive intervention to support physical activity now, yes or no? And if yes, please phrase a message for us. The same task we also gave to healthcare professionals and laypersons. And those 450 JITAI responses that we got out of there, we again handed to healthcare professionals and laypersons to evaluate them. And what we found is that you can see on the next slide. Here in red, you see the results for the large language model, and you can see that the large language model produced JITAIs outperformed the healthcare professionals and laypersons on every scale that we measured, and we looked at how appropriate the JITAIs were, how engagingly they were phrased, how effective people thought that they would be, and how professional they were phrased. We also looked at the effective responses people thought that they would have after getting this JITAI. But yeah, in short, we see that the large language model produced JITAIs worked very well. And with that, I'm now going to hand on to Dominik, who's going to tell you how he's furthering this work in his PhD.
Brilliant. Thank you so much, David. Yes, so we're going to talk about how we can implement large language models for personalization. To give just a brief overview, there are 3 dimensions of how to personalize. The first one would be the intervention or the message per se, which has already been heavily researched from a user as well as a healthcare perspective. The second dimension would be time, defining if a JITAI at all should be sent, and if yes, when exactly. And the third dimension would be context, as we already said, tailoring variables, where we define contextual features such as geolocation, time of the day, user personality traits, as well as the schedule, and then define if a JITAI should be sent and what type, what content a message should have. So that means contextual features are good. Unfortunately, even if we use contextual features, we will still run into the cold start problem. The cold start problem means that AI systems need time to adapt to user preferences and also data. Unfortunately, this users perceive this as a flaw, and after a brief amount of time stop using the system, and therefore the system can never get to the personalization stage. Datasets can be used to avoid this, or at least to alleviate it a little bit. Unfortunately, use cases are usually very specific, and to find a dataset out there on the internet is rather difficult. In our case, this actually wasn't possible, so we needed to do a 2-part approach for the personalization. The 2-part approach is, first, we conducted an online study, which we did this summer, where we had 210 participants to generate a dataset. And in the second stage, which we are currently implementing, we are using the dataset with 40 people whom participated and whom also did not participate in the first study, to compare different large language models that have been trained on the dataset or haven't been trained on the dataset, to figure out what kind of depth of development we kind of need to go for the personalization. A short overview regarding the first study. So we had 3 questionnaires, 5 unique scenarios per questionnaire, and the participants were asked to read a scenario. A scenario would be, for example, it's 9 p.m. in the evening, it's already dark outside, it's raining, you have a deadline in an hour, and you receive a message that you now should do some exercise because you've been sedentary for, I don't know, 5 hours or something. And then the participants need to evaluate how they feel about this message and what kind of features, contextual features, led them to their conclusion, whether they liked it or didn't like it. And we also paired this with Big 5 personality traits. And overall, our insights are that there's no clear variable when it comes to the acceptance of a JITAI, and also that very huge preferences. Different users just prefer different kind of messages. Here we have just a curated summary of some of the contradicting feedback that we received. Some really felt it's heavily motivational, others really hated it. Some thought it's encouraging, others felt kind of like it's not caring or maybe even a little bit condescending. And some, as participant 192, really thought that JITAIs are just not his cup of tea, to put it mildly. And so with this feedback, we were like, okay, we need to find an approach, and LLMs help us with that one. And this is briefly discussing how we can implement this dataset. And we, again, in the second study, use the big 5 personality traits and additional data from the users, combine this with scenarios where we ask the users to give us feedback given a certain situation, so contextual feature. And we then feed this into 6 different kind of large language models so that we can define what kind of level of engineering that we kind of need to achieve. The lower the level, meaning fine-tuning is the lowest one, the more complicated, the more engineering it kind of gets, and the more data we also need. And overall, what we are kind of trying to achieve here is to receive feedback, how they felt, how the personalization went. So we want to, on the one hand, verify that a multidimensional approach for personalization really works, that we can also tackle the cold start problem with this. And the biggest goal that we kind of want to achieve within a year is to really go into the wild, to use personalized JITAIs that really adapt, use technology that has been implemented at the LBI, like ActivePlan and the More platform. Please look that up, they're really interesting. To then really conduct a longitudinal study into the wild to see how personalization works. And David, please, the final slide.
Yes, thank you very much, Dominik. So in a nutshell, or just 3 take-home messages for you, would be that LLMs allow for the integration of messy multimodal data, which wasn't possible before with the JITAI implementations that we had. And therefore, they can be a very promising approach for large-scale implementation of JITAIs. And context-aware AI can increase the JITAI acceptance. That's what we saw in the study that I presented. And they could significantly increase long-term adherence. And yeah, as Dominik just said, all of this work definitely necessitates further experiments that we do in the wild, actually implementing this and testing and seeing how effective those interventions actually are. So if you have any questions, we're of course happy to answer those. And if you want to read up on it, then if you scan this QR code here, then you can find the preprint of the study that I presented, which is called The Last JITAI. So yeah, thank you very much.